A new report estimates that in 20 years, 1 out of every 5 Canadians over the age of 15 may suffer from arthritis. The disease affects people of every age, physical condition, and ethnic background. And if this estimate turns out to be in the ballpark, the already staggering social and economic costs of arthritis are set to explode during the coming decades. Linda Aylesworth has more.
When Amy was offered her dream job working at the Vancouver Aquarium, she wasn't about to let chronic pain stop her. But some days, the juvenile rheumatoid arthritis she was diagnosed with at the age of 13 makes getting through the day a real challenge.
It's a very unpredictable disease, though, in that some days I might wake up and find that I can't clench my fists or I have trouble walking. And other days I bounce out of bed like today and I can ride my bike to work and be really active.
That she's already a veteran of the disease at the age of 26 comes as a surprise to many.
Every time I tell someone I have arthritis, that's their first response, like, what are you, a 65-year-old woman? And I kind of have to laugh now because it's definitely not an old person's disease.
These people with rheumatoid arthritis are hit in the prime of their working and childbearing years.
Dr. Shojania specializes in the treatment of arthritis, of which there are over 100 different types. The average age of his patients is 42, and there are plenty of them.
I'm inundated with patients, so I can't see the people I want to see that are being referred. Already we are over our limit in the number of people we can see.
That's because 4 million Canadians, that's 1 in 6, have arthritis. And according to a recent report, the numbers are on the rise.
We know that the devastating impact of arthritis is only going to increase over the next 20 years. By 2031, 7 million Canadians will have arthritis. That's going to be 1 in 5. And the majority of those will be under the age of 65.
Already, the cost to the Canadian economy is over $6 billion a year. Clearly, something needs to be done.
The only way to deal with this is by research, because we just cannot train the number of rheumatologists, orthopedic surgeons, sports medicine specialists. We don't have the ability to operate on that many people.
Problem is, arthritis researchers receive mere pennies per capita in Canada to do their work. But as they struggle to increase funding, there is something we can do to help ourselves.
If people would address lifestyle concerns such as appropriate exercise, cessation of smoking. Smoking triggers rheumatoid arthritis and lupus. Alcohol in moderation. Then we would really, right now, cut down the number of patients we need to be seen.
That Amy copes as well as she does is because of her lifestyle and advances in medicine. Still, she longs for a life without pain.
I can hope for my future that I will be able to be, fully functioning and not be in that category of having joint deformity or any lack of my ability to, perform everyday things, really.